Hi, I'm Jill Clifton. Welcome to Landscape of Mothers. I want to talk about trust a little bit. Trust is one of those infant acquisitions. So as an infant, we learn something about trust. As we receive care from our caregivers, we learn to predict based on like just cycles and rhythms of life, like when things happen. And we kind of get this sense that we will be taken care of when we let our needs be known. Someone meets us and takes care of us. And so this involves, for an infant, this involves like looking at them, talking to them, singing to them, looking at them while you're feeding them, paying attention, taking care of their basic needs, diaper changes, putting them to sleep. So giving them some of that comfort time to like soothe them into sleep. And to give them some level of stimulation of learning new things. So giving them things to look at and just to continue to like talk to them and engage with them, right? So these are all things that get us, it's that attunement. Our caregivers are attuned to us, and then we learn to trust our caregivers. So one sign though that as a parent, you did not receive that is that it may be that you take on an awful lot of the responsibilities and kind of feel like you have to do everything as a parent, getting them the right toys, the right stimulation, the right amount of time outdoors, the right foods, the right whatever, and and especially when you're not trusting other caregivers to be able to do that for your baby also. So if you find that to be difficult, know that, kind of check in. Do you feel like you received attuned care as an infant? And if not, then you and your infant might both benefit from the same kinds of behaviors. One of them is a consistency, some kind of rhythmic cycle of like, patterns of behavior. We get up, we do, we feed the animals, we feed the baby, we snuggle, we read a book, then we, whatever. So there's just whatever predictable behaviors you might have that are positive connectors between you and your child will actually benefit both of you. It will both obviously take care of your infant, and if you can also tune into it and receive it back to yourself, it's also an act that will start to care for your inner infant and hopefully then start to give a foundation for the restoration of trust. So beyond that regularity of care, allowing other people to nourish and nurture you, learning how to really receive. So being able to take in hugs from friends or kind words from friends or intentions from people who are trying to give you a compliment. That might be another place that you might recognize that you don't have trust. It might be an indicator of a trust wound. And then taking care of yourself, being reliable about your own food, your own showering, your own getting enough exercise and things like that. So those are all things to think about if you feel like trust is an issue for you. Hope that helps.